the same format as yesterday's press update. We'll begin this morning with Mayor John Cooper. Then we'll hear from Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force, followed by Dr. Adrian Battle, Director of Metro Nashville Public Schools. And we're also joined by Sonia Hostetler, President of Kroger Nashville Division. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of OEM and the Nashville Fire Department are with us to help answer questions. Once again, if you'd like to ask a question over the air during our Q&A session, please click the raise hand button next to your name at any time. Those of you joined by WebEx, if you're having any technical difficulties, please let us know in the chat function. And with that, we'll begin with Mayor John Cooper. Thank you.
Thank you all for joining us this morning. We're continuing to practice safe social distancing protocols as prescribed by the CDC, and I appreciate the media's cooperation as we provide daily public updates by video conference to protect all participants and members of the press. Yesterday at 3 p.m. I signed Executive Order Number 6 stating a state of emergency throughout metropolitan Nashville and Davidson County as we confront the coronavirus disease in our community. This executive order will help metropolitan government and our partnering healthcare providers with a more rapid resourcing and decision-making capability as we work together to keep our community safe. Just as the federal government, governor's office, and local health department have declared their own states of emergency to prevent the spread of virus and help those who've been afflicted, Nashville will use this declaration as a valuable public health resource. Now, the Emergency Operations Center has been activated and staffed around the clock since 2 a.m. on March the 3rd in response to the tornado that swept across our city. EOC staff, led by Director Chief William Swan, are finalizing preparations to add Metro's COVID-19 response activation to this mission, which will support the clinics and hospitals already in place to help Nashvillians throughout Davidson County. I'd like to thank Dr. Adrian Battle and her team at Metro Nashville Public Schools for prioritizing the safety of our students and providing meals to help ensure that Nashville children do not go hungry as we work to keep them healthy. Every generation has their own stories to tell, and I know for our youngest generation of Nashvillians, this will be a good one. I'd like to recognize all Metro personnel, especially our first responders who have worked so hard over the past several weeks, and the frontline staff at area healthcare facilities who are working diligently to care for Nashvillians during this challenging time. We are working hard to make sure that you have the resources that you need. As a reminder, all Nashvillians can visit covid19.nashville.gov to stay informed with up-to-date public health information and the status of Metro government services, as well as the latest CDC guidelines on staying healthy and safe. Yesterday, we announced the creation of the COVID-19 Response Fund, which has been set up with the help of the United Way of Greater Nashville to help support our neighbors who are experiencing lost wages or who become ill from the virus. The Nashville Convention and Visitors Corp made a generous $500,000 contribution to help the COVID-19 Response Fund to get to its first $1 million. This morning, I'm very pleased to announce that the Frist Foundation will be making a $1 million contribution to the COVID-19 Response Fund. We're enormously grateful to the Frist Foundation for their generosity and ongoing commitment to Nashville, particularly to our most vulnerable residents. You can visit the covid19.gov site to make a contribution to the Response Fund and help our neighbors in need of assistance. Nashville knows what it means to work for the common good in times of trouble, and I'm thankful to everyone for doing their part to prevent the spread of illness in Nashville. And with that, I'd like to turn it over to the Chair of our Board of Health and the Chair of our Coronavirus Task Force, Dr. Alex Jahangir. Thank you.
Thank you, Mayor Cooper, and good morning. Let me start by giving you the latest information on the spread of COVID-19 in Nashville and Davidson County. Today, we have a total of 60 confirmed cases in Nashville, Davidson County. That's an increase of 14 cases over the past 24 hours. The patients range in age from 11 to 73 years old. Of the confirmed cases, 2 are hospitalized. The other 58 cases are self-isolating at home and have mild and manageable symptoms. We expect the number of cases to increase as testing increases. I cannot emphasize enough, the best way to limit the spread of this virus is to wash your hands regularly, stay home if you are ill, clean your work surfaces and common areas regularly, and practice safe and strict social distancing. We continue to make progress on launching our community assessment system for residents of Davidson County who are concerned about whether or not they have been infected with COVID-19. This is in addition to our already robust infrastructure of healthcare that is in place here in Nashville that is currently assessing and testing patients for this virus. We are working closely with our state partners to get the supplies we need, and with the hospital systems and medical colleges on the logistics of the system, and will announce soon when we will launch them. I particularly would like to thank Commissioner Lisa Piercy, as well as Drs. Tim Jones and Dr. John Dunn at the Tennessee Department of Health for their steadfast support and assistance to us as we work to get these community assessment centers operational. I also am grateful to Director Chief Swan and the men and women of Nashville's Office of Emergency Management for working around the clock to get these sites up. As a result of these efforts, today, Director Chief Swan and I will be conducting inspections of one of the community assessment centers. This will be one of several centers around our city where citizens can get assessed and, if indicated, receive a COVID-19 test. After our inspection, we will invite the media to join us so that we can walk them through the entire assessment system, from the hotline to the use of the centers. We will be sending out the exact time and location for that walkthrough after this briefing. As a reminder, the community assessment system will help those who think that they may have the virus. Residents will first call the assessment line, and then, if necessary, will be directed to the assessment center for further screening. Our mission is to combat the virus and flatten the curve of spread, and this begins with each and every one of us. Every citizen has a responsibility to slow the spread of this disease by practicing common sense measures. Stop going to crowded places. Limit your groups to no more than 10 people. Maintain a 6-foot distance from others whenever possible. Don't shake hands. Wash your hands often with soap and water, and if soap and water is not available, use an alcohol-based hand sanitizer. Cover your mouth and nose with the tissue when coughing or sneezing, and stay at home if you are sick. We continue to need your support and patience, and we will continue to provide you with new information as quickly as we have it. And remember, for the latest update on Nashville's response to COVID-19, as well as information on Metro and community services, please visit covid19.nashville.gov. Thank you very much for your attention. And now I would like to turn it over to Dr. Adrian Battle, Director of Metro Nashville Public Schools. Thank you.
Thank you, and good morning. Metro Nashville Public Schools are going to be closed through April 3rd. Over the course of the next 2 weeks, we'll work with the Mayor's Office and the Health Department to monitor the ongoing threat from the coronavirus and make a determination as to when schools might reopen, while putting the health and safety of our students, their families, our staff, and the community first. However, I want to be clear that this is not a time for inaction. Our team is working to provide resources for students and families to continue learning opportunities while they are home, and we will continue providing resources and updates during this difficult time. We are asking families to find ways to engage students in productive learning activities while staying healthy and active. You can visit www.mnps.org/digital tools for resources and plans to fulfill the instructional needs of students over the extended closure. MNPS will not be offering remote learning services at this time. This is an equity issue. Quite simply, not all students and families have the necessary devices and internet access required to conduct remote learning. This is also not an ideal learning option for many of our students. We are aware of concerns from many of our students and families regarding graduation, grades, transcripts, and other important issues, particularly for our seniors. We are working on solutions in conjunction with the State Department of Education and other relevant agencies to provide solutions to these challenges. We will provide updates as soon as they become available. The Tennessee Department of Education has requested federal waivers on assessments and accountability requirements, and the Tennessee General Assembly is considering legislation that would create or allow waivers for state testing and instructional day requirements for students and staff. We will be requesting waivers for our district once those processes have been put into place. Despite schools being closed for the time being, the work of Metro Schools does not end. Yesterday, we had 9 schools participating in our Community Achieves program to distribute food boxes provided by the Second Harvest Food Bank of Middle Tennessee, as well as provide food by the Bridge Ministry. Additionally, Bookham will be generously providing books for students in need next week. Next week, we will also be offering breakfast and lunch to all children of Davidson County under the age of 18, as well as finding additional opportunities to support our families in need of nutritional assistance. You can find details and locations as well as continuous updates about our response to the public health emergency at www.mnps.org/COVID-19. At this time, I would like to introduce Sonia Hosteller from Kroger. Thank you.
Good morning, and thank you, Dr. Battle, and to Mayor Cooper for having us here today. Over the last week, our stores have obviously been extremely busy. We are working 24/7 with our distribution centers and suppliers to help replenish our items our customers are looking for as quickly as possible. Trucks are arriving at our stores daily. Our manufacturing partners have added shifts to keep up with the demand. We are working towards prioritizing those most needed items like water, paper products, and baby items. The supply chain is strong and continues to adapt to the increased needs of our customers. We expect our conditions and quantities to continue to improve on a daily basis. We have reduced our hours of operation to 6 a.m. to 10 p.m. to allow time for cleaning and restocking across our stores. We are continuing to provide our customers with free disinfectant wipes at our entrances to sanitize all shopping carts and/or baskets, or have an associate at the entrance that is doing this for them. We are cleaning commonly used areas more often and following best practices for safe food handling as we normally would. As we experience an increase in business, we obviously are needing to hire individuals for our stores. Candidates can apply on jobs.kroger.com and can be placed for employment over a quick period of time. To support our communities in need, the Kroger Company Zero Hunger, Zero Waste Foundation has committed $3 million to combat the food insecurities. The funds will be equally distributed between Feeding America and No Child Hungry. The funding will not only support the food banks nationwide, but also the fund's initiatives that ensure children whose schools may be closed still have access to the meals. The health and well-being of our associates and our customers and our communities is our top priority. Preparedness is in our DNA at Kroger, and our store teams are regularly managing through severe weather events like the recent tornado that hit Middle Tennessee. And our teams are always well prepared to be there for our customers. I want to also take the opportunity to thank our associates and our managers and what they're doing in the stores to help our customers across the Tennessee area. Kroger will continue to serve our communities with open, clean, and well-in-stock stores. We thank all of our customers for your patience during this time. Thank you.
Thank you to all of our speakers today. Due to technical difficulties on the WebEx platform, we are unable to facilitate a question and answer session today. We will continue the Q&A sessions as capabilities permit. Later today, a video recording of this event with full audio and video will be made available to the media, and members of the media will all receive a link for tomorrow's video conference. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.